So you mentioned resources and getting help from the industry. In my office, in every room, I have the diagram from Urolift about the different stages of bladder health, or at least with the picture, which I show the patient, hey, this is what we're trying to prevent. Once it is at the end, that's it. And most patients, hey, but I was never told this. I was told the PCP says that everything was fine. And that's why I asked you at the beginning of this, because sometimes the PSAs wanted this. They think that everything is normal. So, well, they're talking about prostate cancer-wise. Definitely BPH or Prost void is something different, and it shouldn't be normal with your age.
The resources are critical. The number one resource is our minds. We have to come in recognizing this is a mechanical problem, that this is a mechanical solution. Medications are part of the equation, but they are temporizing measures, and that we are going to be their guide, and we're going to get them the data. Number two, very simple, our eyeballs in our hands. When you look your patient in the eye, you hold up their IPSS with their handwritten IPSS score and their signature in the bottom. You say, hey, Mr. Smith, this is a problem. That is a huge resource. That is a huge igniter. Because when they hear it from someone they trust, oh my gosh, that's a problem. That's not fine, Mr. Smith. Right there. And that takes care of that whole problem you talked about, right? And then our hands, right? I use a lot of gesticulation, showing the prostate as a mini donut, getting tighter, the bladder squeezing like an octopus. And the reason why I bring it up is we have it all right here. Yes, those resources like the pictures of trabeculations help, but it's not, you don't have to always rely on those. If you guys do have that trabeculation photograph showing the progression from a normal bladder to a severely trabeculated bladder with cellules, that is fantastic. Quick tip, get two of them, one in the patient consultation room, get another one, put it on a foam board, attach it to the wall right next to the cysto, or hanging off the side of your cysto monitor so you can show exactly what their bladder looks like versus the one that you already taught them about in the pre-cysto counseling. The other resources out there, for example, ManVsProstate, we're trying to create flow charts, report cards, list of surgical categories, decision-making aids for patients that should be coming out this spring, as well as flow charts for each types of practices, depending on what you have, whether you have CystoTrust, Uroflow, CystoTrust, Urodynamics, CystoTrust, Urocuff. There's not one way to skin the cat. As long as you're presenting all the data about Detrusor function, prostate size, prostate shape, and talking about the 5 stages of bladder health and however you want to do it, that could be very helpful. And then there are more formal avenues for resources. One that just came out is called bphtool.com. Based on a lot of data, especially the combat trial, it lets you look at if you put someone on medications, tamsulosin, dutasteride, combination therapy, what can you expect their IPSS score to improve by, as well as what is the potential risk for acute urinary retention episode over the next 4 years. Wow. Now we have a tool for compliant, for medical legal. They say it's not a clinical tool, but take it for what it is. But now you have something to say, hey, look, Mr. Smith, that's your risk. We don't want that risk. Our goal is to keep you out of stage 3, 4, and 5. This is something we need to think about. Other resources out there, just to give a shout out to the Canadians, they have the decision-making tool for choosing types of surgeries, de-obstructing technologies that might best fit a certain patient for his prostate. And so that's also another great tool and resource.